I have the distinct honor of introducing my friend and colleague, and I'm so grateful to call her a colleague because I have deep respect. Karen Rubenstein is an LMFT licensed marriage and family therapist with a specialization in addiction and co-occurring disorders. She earned her Bachelor of Arts degree in Business Administration from California State University, Northridge, and Master's of Arts degree in Psychology from Phillips Graduate Institute. Karen has been with Cliffside Malibu, our sister program, since 2014. Karen's work in bringing the clinical philosophy using the stages of change, evidence-based practices, and the Therapeutic Alliance to life goes unparalleled to any other treatment program. She works closely with the clinical team by guiding them towards utilizing a center of excellence philosophy and ensuring the clinical program at Cliffside Malibu is at the forefront of the industry. Karen has over 20 years of management experience and has been working in drug and alcohol treatment since 2004. She has extensive experience with managing and structuring clinical programs that best meet the needs of the clients. And I just want to say on a personal note, I was fortunate enough to attend an immersion at Cliffside and ARC last week, where Karen is the clinical director, and I walked away with a profound respect for the work that they're doing and for Karen as a professional. And so I'm so excited to have her join me on stage and talk with us about the Therapeutic Alliance. Karen! Woo!
So, well, first off, I was going to have everybody after lunch stand up and stretch, but after that, no need to get you guys engaged. Thank you, Jen. That was so sweet. That's very impressive. Who is that person? Thank you guys for having me. I'm going to go into a little bit about our clinical philosophy and why I feel and believe very strongly. And one thing I know in all my years of being at Cliffside Malibu, Cliffside Malibu and working in the field of addiction is the learning to be adaptable and flexible. With the ever-changing landscape of addiction, you have to. I don't know, many of you might know, in 2018, Cliffside Malibu was hit by the Woolsey fires, and we lost about 5 of our facilities during that time. And then as we were on the upswing and regrouping, reconnecting, then COVID hit. So you guys know, and I'm sure you've experienced different, struggles and barriers and things like that in treatment. But it also teaches us to be resilient. Right? It teaches us how to move along with the flow of things, right? And learn from tragedies or, traumas. One of the things I took the opportunity to do at Cliffside Malibu was to get our clinicians during the time of the Woolsey fire and really dig deep into our philosophical ideas, right? We knew who we were, we knew who we are, and how do we put that into a philosophy and strengthen our program, right? It was a great opportunity to grow our program. And some of the things that came out of it, I'm going to back up a little bit. One of the things when TJ asked me to speak, he was talking about what's emerging, right? So right away I'm thinking, do I have to come up with a whole philosophy for myself, the Karen Rubenstein philosophy of how to treat clients? But I actually looked up the definition, and I wanted to know more about it. And I think Jen said it beautifully when she was talking about all the veins of water coming together and flowing. And I think we can't do that, in this field without one another. And that's sort of what Emergence, if you look it up, it's a grouping of ideals or philosophies together that allow us to kind of come up with new ways, right? And I think that it's challenging at best, right? So that kind of took me back to, we were talking, I know Jen talked about sort of what's happening in the, field of addiction and what's coming up for us. Dr. Shipman, he talked about, what happens in the brain and the upcoming medications and things like that. And I think those are all important. I absolutely do, because we can look at things and we can talk about the treatment of the day, right? When we're pushing EMDR is the new buzzword, or trauma-informed, and all of these things that we know that work. However, how do we get there, right? How do we get to where, to apply all of those? So I'm going to tell you a little bit about, let me back up. When we were talking about emerging therapies, we have those different modalities that come up. We also have the medication-assisted treatment. I was really, I wanted to hear so much more about the ketamine, because I think that's kind of up and coming. And I noticed, I saw the body posture I was sitting in the back, and I saw the body posture as he was talking. Is he going to go this way and support it, or is he going to go this way? And everybody I know was like tightening up. And I get it, but that's what pushes us as clinicians too, right? How many of you in this room are clinicians? Okay. So more business development rep type people. I think what I cover, type people, I didn't mean it like that. Business development, I love that world, but. Huh? Best part. Actually, yes, because you are the mouthpiece for all the people that, you're representing. And that's huge and important. The reason why I asked who's a clinician in the room, because I'm going to talk about something that is so important to me philosophically that can be applied even in the work that you're doing. We're here about connection, right? How are we connecting to people? How are we getting business from people? And it's not because I firmly believe that you're going to refer to those people that you connect the most with, right? Who you feel safe with, who you feel like might have a handle on what your center has to offer. And so, we can talk about, well, I've heard it before, treatment centers saying, well, we meet the client where they're at. My question always to other people is, well, how do you do that? How do you meet them where they're at? So our clinical philosophy at Cliffside Malibu is based on 3 tenets, that being stages of change. I think you heard Jen say that. Evidence-based practices and Therapeutic Alliance, okay? So why the stages of change? For us, the stages of change is an added layer of assessment. It allows us to identify the client coming in the door. Now, the clients coming in the door all think they're in action stage, because they think, oh, I'm here, I'm ready to do this, I'm committed. And most of them are really in pre-contemplative, right? They might be at action stage in other areas of their life, but they are coming in with some kind of resistance. They're coming in for help, essentially, right? Because they can't do it on their own, or they would, and they wouldn't come to treatment. So the stages of change just gives us a foundation to build on with a client. It's not necessarily about how are they progressing through every stage of change, but how are they progressing within a stage of change. Because I will tell you, from detox residential all the way to outpatient, we're probably still looking at people being in the contemplation stage, right? It's a long road, but we don't want them to get discouraged. We want them to know that this is part of the process, right? So part of it also, too, with the stages of change is acting on a willingness to act on a healthy behavior. So that's very different than coming in, and I think you touched on it, Jen, the stigmatization of the word addict or being in recovery. So this, again, it's appealing to the healthy side. Evidence-based practices, we know they work, right? We know CBT, DBT, EMDR, trauma therapies, we know they all work, and they are emerging. The other day, we had a tour. They talked about box therapy. So right, for me, I'm thinking box, like maybe you put your traumas in a box or something, but they literally do physical boxing. So there are music, boxing, any myriad of things, right? My thing is, how do you get them there? You know, how do you guys connect? And I do want to open this up, and I do want to make this collaborative because this is why we're here, right? How do you connect? How do you connect with your peers in business development? How do you connect with your clients in therapy? Anybody? Relatability, of course. Honesty.
Open heart.
Yeah, yeah. Open heart.
Attunement.
Attunement.
Finding their pain points.
They're what?
Their pain points.
Pain points.
Trust.
Trust, for sure. Because isn't that true for us? I mean, if we don't trust somebody, we're not going to listen to them. We're not going to follow their lead. We're not going to do anything, right? So that's how you connect, and that's how you get a buy-in. So when you hear, let's talk about Therapeutic Alliance. So you hear that buzz term, the clinicians in the room. How do we define Therapeutic Alliance? I see people smiling going, there is no wrong answer, people.
It's a relationship that supports some kind of behavioral change.
Absolutely. What else?
Cohesiveness between the client and the therapist.
Right, right. So all correct. You know, when you define it therapeutically, it's you're in agreement with your goals, you're in agreement with your tasks, and you are collaborating in a positive relationship exchange, right? And that's a therapeutic alliance. Now, further into that, we kind of dig deep. At Cliffside, we call it the love call, right? Our ideals are we love them in the door, we love them while they're with us, and then we love them out the door, right? And that's hugely important to us because how do you, I want to talk today about the things that you can do to connect, to get what your needs are. And, you know, in sales or business development is if you're connecting with people, you're connecting with them going, oh, I really like that person, and that's how I'm going to remember to refer them. As a therapist, you're thinking, I trust them. I trust what they're doing. I trust what they're saying, right? And therefore, I will listen to what they will say to me, and I'll collaborate with them. Because without that buy-in, the evidence-based practices, we can cookie cutter treatment plans all day long, but it's not going to work, right? It's not going to work. You're just going to be sitting with your client. One of two things is going to happen with that client. They're either going to be compliant. Those are the ones that come in and out of treatment 20, 30 times, right? They're going to say, I'm going to be the good student, I got an A in treatment, and I'm going to be out the door, and then they didn't learn anything, or they're going to leave treatment early, which we are, is, you know, it's our four-letter word in treatment is ATA, against treatment advice. You know, we don't want them to leave. We want them to stay, and we want them to engage in the treatment, right? So that's why it's so important. So the things I'm talking about, and I'm not even following my cards, so there you go. And I brought cards because of computer glitches, and I'm not computer savvy, so I'm old school. So nobody's going to take my cards, or it's not going to re-upload or re-update. Okay, so we talked a little bit about that. Does anybody have any questions so far? No? Okay, great. So part of that is in the ideals of Therapeutic Alliance, how do we, the tools that we're going to talk about, the kind of buzzwords, I think can be used in anything. And this is how you gain the connection. Because for me, the love is the connection, right? If you get, when you have trust, we named it here, right? Trust, respect, what were some of the other words? Short-term memory here. Right, connection, all of those things, then you start creating a bond, right? one beautiful thing, the reason why I feel strongly why this works is because even today, first off, this is like the first conference I've been out since COVID because I had a granddaughter. I have to throw that in. And so it took me out of a lot of conferences that were kind of reigniting and everything. But I felt it when I walked in the room, the energy, and that kind of re-energized me a little bit, right? Getting connected with everybody and reading what's going on for you and talking to people that I haven't seen in a really long time, and it warmed me, you know? And those are the people that I remember that I think, oh, we want to refer to those people because they're like-minded, right? And so when you talk about love, it's strengthening that bond with the client while they're in treatment. And one of the barriers we're up against is we have clients that come in on insurance. Everybody here, I'm sure, has experienced that. And we're only getting a finite period of time. So why is it so important for us to get that alliance really early on, from the minute they walk in the door, right? Yeah.
You know, you said something that is huge for me when you talked about, I don't think you would use the word synergy, but you walked in the room and you felt the energy in the room. Really, it's synergy. It's the synergy of the people here. And I'll say this, and I'll say it openly. In this room alone, there are more people that I got a new phone and I'm almost 70 and I'm like so not tech savvy. It's disgusting. That I respect, that I trust, and I feel safe with in this field. But that is super important to me. So when you think about working with, and you ask a clinician, I raised my hand because I'm a doctor, so I saw it different like you, Dr. Channer. So many people that have been in their addiction, especially those who, I don't even think if it's been homeless or whatever, but when you deal with drugs at a particular level and you have had an ACEs, unsafe, negative exposure as a child, you feel people who aren't safe, that you're in therapeutic sessions.
For sure.
You know what I'm saying?
For sure.
So I think what's really important is that, for me, personally, is I'm constantly doing my own work. I go to therapy every Wednesday, on the clock. And is that we're really doing our stuff, taking care of our stuff, and that we aren't going in there unwell. We're getting
That's
into
right.
transference and all that stuff.
That's
I think
right.
that's where the big problem happens, and not to be critical, there's so many people in field who aren't well. They come into it, they're out of addiction or become counselors. They've not done any of their work. They come in.
That's
and
right.
You've got this patient, and you want to help them get well. When the best thing you can do, if it's a lifetime, I've been clean 30 years. I love seeing Dr. Cressy on Wednesday because she tells the truth. I need it. God, I know I need it. But it's that we as professionals, whether it be addiction counselors, clinicians, doctors, whomever, that we present well because we're taking care of our stuff.
That's right. That's absolutely right. And that's actually one of my bullet
Oh,
points.
sorry.
No, thank you. We're on the same page. That's
Okay.
what that means. But that's absolutely true. Because, one of the things, if we gain the Therapeutic Alliance very early on in the treatment, guess what? We're in the driver's seat. So often, part of the struggle that I have with some of the clinicians that, kind of new or they get stuck, right, is I ask the client what they wanted to work on, right? And when the client is confused or I hear in our treatment team that the clients are running kind of rogue, I'm always going back to, what are you working on? How are we directing the clients, right? And if you don't have that alliance with your client, they're going to just be compliant, leave treatment, or they're going to ATA, right, and leave treatment. So those are all important factors, and that's why the Therapeutic Alliance for us isn't just about the clinician to therapist. It's also with the very first person that they meet when they walk into our facility. right? We train all of our staff on our philosophy. We train them on the importance of Therapeutic Alliance. We go through crisis management because the number one thing I hear when they are, writing their exit surveys is, I felt heard. And they are always thanking the behavioral techs who are in their, in their faces 10 hours a day, 8 to 10 hours a day. Right? And so if we don't utilize them to connect with the clients, then we're doing the client a disservice. Right? So some of the tools that I want to talk about are kind of things that I came up with just as a way to work with your clients. That's all. A way to work with beings, people, your kids, unless you want to kill them like Dr. Shifman, but that's okay. Which was very funny to me because I remember those days very clearly. So do you guys have any questions so far? Okay. One of the things to start out is listen. I mean, I think that sounds so simple, like, duh, we're supposed to listen. But so often we get so ahead of ourselves of what we want to accomplish that we're not listening, right? And I teach myself every day, even coming to these. Like today I was a little nervous / I guess it's excitement when you're nervous. And somebody's talking to me, right? And I'm thinking about my presentation. I'm thinking about, okay, got to get it together, they're listening. And I noticed in that moment, I'm disconnecting, right? I'm not listening to what they're saying. And I forcibly have to make myself, because it's important, right? Because the end goal is I don't want that person to walk away from me and going, oh, she doesn't care about me or my treatment center, which I do, right? I think there's a lot of business out there, and I think we're all have the same, end game, which is helping people. So listening is key. Listen, listen, listen. And don't cut off people, don't interrupt people. We have to kind of train ourselves. The second thing is obviously validate. How are we validating our clients / the people we are connecting with, right? This isn't in my practice in my private practice, oftentimes I say, well, do you want to be right or do you want to be in a relationship, right? And they mistaken validating people as I'm telling them they're right and I'm wrong. And it's not about that. You're validating their experience so you can accomplish one thing, and that's slowing down the process, right? So you don't kickstart that first thought in your head that I'm coming back with a comeback to this person, right? Just validate how they're experiencing. That's it. It slows down the process. It gives you time to gather your thoughts and ask questions, which is my next one. When we're unclear, how do we ask questions? When we don't understand what our client is going through, how do we ask questions? Things come up in treatment where people say, well, are you in recovery? You can't help me if you're not in recovery, right? And I think for me, whether you're in recovery or not, I would never assume what it's like to walk in your shoes, right? It would be a disservice to you, and I'm not better than you, right? The connection you're going to get is they're going to become defensive, and you're not going to be able to accomplish what you need to accomplish, right? So validation, I think, is key in any relationship. I said ask questions. That's key. When I don't understand, tell me more about that. What did you mean? I'm confused, right? Tell me about what that experience was like, because I can imagine what it's like for you, but I'm curious about this. So you're asking questions to your clients, to the person that is speaking to you, in everyday life. So though, asking questions is helpful. One thing I know is big on everybody's plate here, especially TJ, is authenticity. I will tell you, clients can see through your bullshit. right? And when they do, they go for the jugular. They manipulate you. They tell you what, oh yeah, I got this, you know? And if you're not authentic with those that you are treating, you are not helping them, right? When you have a therapeutic alliance, you can say to your client, I call bullshit, right? I don't think you've got this. This is why, you know, and it's not going to disrupt the therapeutic alliance because you've gained that trust already, right? Be clear, you know, be clear on your expectations that you have for your client. Let them know this is what I need from you. And if they don't understand, make sure they, you know, ask them to repeat back to you. Sometimes that's it too. What did you hear me say? Because so often it's like, yeah, I heard you, right? So just, it's a way of checking in, right? And be confident. Again, back to the client. They think that they know every loophole to pull one over on you, right? They know when you feel uneasy with them or uncomfortable, they know it, and they will call you on it. So, and they see it, and then they don't trust you. And that will disrupt, again, your therapeutic alliance. Does anybody have any questions regarding this so far? No? Okay. So once you've done all that, ask for a commitment. How do you ask for a commitment from your client? Right? Are you willing? Does this work for you? Are these goals that you feel like we can get through? And this is how I'm going to support you doing it. But be very, very, very committed. And make a commitment also to your client. Because they want to know that you're going to be the constant in their lives. They, you know, Dr. Shimma talked about that disruption of the of where the shame comes from. And so we are in treatment recreating a positive repair, right? Through doing the therapeutic alliance, we're getting their trust, and we better be confident in what we're doing so that we can really guide our clients through treatment, right? Because they're relying, their lives are depending on it, essentially. Don't argue with your client, which I see a lot. It's like, you did say that. Well, no, I remember when you said that. You were sitting right over there. You were doing this. We were eating lunch together. And we get so caught up in the noise, right? We're trying to prove each other right and wrong because, and by no fault of us, we're trying to help them. So we want them to be aware. But the minute we start arguing with them, again, it's a way for them to say, you know what, I'm out, I'm not doing this. You know, you don't get it, you don't, you know, all of those things that come up as a result. This came up today, which was really ironic, was have a sense of humor. I saw where this room went when we talked about blowjobs, but that's just, I'm just saying. I go, oh, everybody's awake all of a sudden. So have a sense of humor. There are moments of lightness that you can be with people. You know, yes, addiction is a serious, serious issue, but humor can help create levity. You know, we can joke with our clients, we can play with our clients, but they know the difference. They know when you're being serious, and they know, you know, how you're trying to help them. That's really, really important. So I was asked to say a joke at the beginning of my presentation, and I didn't, because the only thing I could come up with was like a knock-knock joke, believe it or not. So no. You know what? I walked right into that one, right? I know. Okay. Knock, knock. Boo. Don't cry. I told you why I didn't do it. I hear jokes all the time. I go, oh, that's such a great one. You can tell all these stories around it. And I'm like, knock, knock. So anyway, be thankful. I didn't start with that. The other thing is appeal to their healthy side. I think with the stages of change, the one thing that it really creates a foundation around is their willingness to act on a healthy behavior. We don't, in addiction, fail in every aspect of our lives, right? We have successes. You might be in action stage in one part of your life, and you might be in pre-contemplation in another. So it's broadening that scope for our clients. And when we point those things out, you guys know it. We have successful business people coming into treatment, right? And we also have homeless people coming into treatment, right? There are things that we can connect in their life that were good decisions, right? So that's really important, to not be caught up in the mire of the consequences of their use. Check in with your client. I know that's one of the things I always encourage our therapists to do, is checking in with their client. How are you doing? Is this working? That's part of being confident. How's this working for you? I notice you're a little, and be very observant, is I notice you're being, you're a little closed off. How is this working? And periodically do it, not just at the beginning when we're like, okay, do you like me? So check in with your client throughout their treatment stay, or check in with your referents. How am I doing? How is this working? What do you need? So again, these are things that can be applied across the board. This is the one, she's not here now, but the one she brought, take care of yourself. The work we do is really difficult. It is showing up for our clients every day is really difficult, carrying some of the load that they talk about. And if we don't take care of ourselves, whether it's countertransference, transference, you can put names on it. If we come into work bogged down with outside things, the clients end up taking care of you, right? Oh, I don't want to tell them, I know you're going through a lot, or I see you're going through a lot. I, don't want to talk about that. So it is very important to Dr. J, is that her name? Dr. J's point as far as taking care of yourself and really identifying, oh, this hits me here. I've been sitting with clients where they are talking about the very same thing I'm absolutely going through. And I'm thinking, oh God, I'm giving you advice? No. And you go, yeah. I go, I know what that's like. I know what that's like to feel sad, to feel disconnected, So you can utilize it to the experience with your client, but you can't bring it in with you. You can't bring your baggage to work. It's going to show up. So it's really important. The last thing as far as the tools is be reliable. If you're making a commitment to show up at 1 o'clock, be there at 1 o'clock. That's my pet peeve. I always tell my clinical staff, if you're not 5 minutes early, you're late. Be there on time. We got lots to talk about. But I think it shows that you care, your intentions, even if they don't. Showing up and being a consistency for them is really important. Really, really important. So that's the last of that. The last thing I want to touch on is about families and collateral and support. I think for the same reason that we connect at Therapeutic Alliance with our clients or colleagues, the family and support system is so key. And we have to practice these same skills with the families as well as with the clients. Because when they walk out the door, if they don't have the tools to manage what they learn, we're just taking them and inserting them back into potentially something that's going to lead them right back to relapse. right? So family engagement is really, really key. Connect with the families, whether it's getting information, getting, their experiences of it. They feel they want to get heard. They want to trust you. They also, you want them to be your ally with the client. And, I think one of the most important things about that is letting your client know, I'm going to contact your family and this is what I'm going to say, right? Because they're so scared that you're going to hear their story, believe them, align with them, and then you're just another enemy to what they're already going through. So that is, we engage our clients from the very beginning. Hey, your client landed safely. We're going to contact your family, and we're just going to gather information. And I always tell my clients, there is nothing that I will discuss with your family that I haven't already discussed with you. And I'm not going to hold secrets. I'm going to bring it to the forefront, and then they feel safer with that connection. Okay. Do you guys have any questions? It's very quiet. Either the food was like really, really good.
I have one.
Uh-huh.
Can your alliance, your Therapeutic Alliance, be broken and repaired?
Absolutely.
And can it be, like, again, there are little things that when you just don't, you're not there and you have to go, okay,
Yeah.
I'm back, I'm sorry, or whatever, but what happens if it's a big break?
My go-to, authenticity. I screwed up. I made a mistake. If it's something to that, I shouldn't have done that. I think the more honest we are with them, the more human-like we are, as opposed to, they've got you up on this pedestal. You're supposed to know better, and you did this. You know what? I made a mistake. And we've seen that happen. We've seen it happen, and where the client will say, I want to change my therapist because my therapist did this, right? And we're not so, eager to just say, okay, let's start, with somebody new. We would rather have them work through it. And then, we'll talk to them. Are you willing to have this conversation? Because we know the ego strength of them when they're in treatment and they're raw is not the greatest, so we have to support that. How about I sit with you and we talk about this together? Let's find out the intention. Let's talk about the intentions behind it. So, yes.
One question. I have a patient. The client, after a second week in medicine, we started to tell him that we need to attend some 12-step meetings.
Mm-hmm.
After he came back, he said, I don't like that idea. And he said, this thing is a temporary treatment, and eventually, after this, it's going to be that.
Yeah,
And then he quit the whole thing.
right.
What are you
Well, I'm smiling because that does come up all the time. I don't like 12-step. I didn't like this meeting. It was this, it was that. Go try a different meeting. Because what I always say is group process or group gatherings is the fastest way you're going to learn about yourself. You might not like something, you might not connect with it, but it's an opportunity for you to identify what you don't like and what you do like, and try another meeting. I think group process, and within the stages of change, group process or group community is the fastest way they're going to heal. So sometimes when it's explained to the client that way, they're a little more open. Come back to me and report to me what happened. What didn't you like? What did you like? Because they're not connecting on the stories, because no one story is alike. They're connecting on the underlying. I too felt shame. I too felt sad. I too lost, respect and trust in my family and relationships. So that's the way that I try to present meetings to people, is giving yourself an opportunity to learn about yourself and take it back to your therapy. you know, and I task our clinicians also to talk to their clients and say, this is what I want you to practice while you're in group. That's a whole reason for groups, right? Is you're practicing the things you're learning in individual therapy and learning information, good or bad. If you're, you know, whether you like the facilitator or you don't like the facilitator, you have an opportunity to identify things for yourself. And that's the route we go when people are resistant to that. Because, and also there are so many meetings out there, maybe it's just finding the right group of people. I mean, right? Anyone else? No?
When I was in Tennessee, and that's where I really got my first exposure to 12-step programs, I didn't like the idea that every time I turned around, somebody shoved God down my throat. I had an issue with that.
Right.
Which, when I came out to California and getting connected to a program because it was something that I wanted to do, it was a completely different experience. If somebody was telling me to do this, it's like, for me, if somebody was telling me that this is what I have to do, and this is the only way you can do it, I'm like,
Exactly. Well, none of us, right? None of us like to be told what to do.
I don't want nothing to do with that. But then that exploration of, okay, let me find my space.
Right.
And keep going until I
Right.
do.
And you can empower your clients. That's a great thing. You can, once you have that alliance with your, you know, your clients, you can steer them to do anything. We have one therapist that is so just beyond. I've never seen anybody connect and gain an alliance to a client as her. Her clients don't move. They don't leave treatment until she says they're ready to. She says, these are the goals. You have not accomplished this goal, very clear, very concise, and they trust her. You know? So, to your point, if we tell somebody who's not ready, you have to stay 90 days, whatever the magical number is, right? You have to stay 90 days. They're going to, no, I don't. I'll get this. I'm coming into treatment for 7 days. And we do get those. So thank you guys for sharing and asking questions. That's all I got. So thank you guys very much.